If you have diabetes, you should make regular visits to your eye doctor because it can impact your eyes. In this episode of OCuTALK, Dr. Damaris Raymondi will be talking about diabetic eye disease, including diabetic retinopathy, and the importance of early detection. Dr. Raymondi?
I want to talk to you.
Not now, later.
No, now.
Hello everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us. From Sir Eye Care in Queens, New York, Dr. Damaris Raymondi. Dr. Raymondi, thank you so much for joining us today.
Thank you for having me, Nick. I'm so excited to chat with all of you today, all about eyes.
Excellent. Well, we're very excited to have you, and thank you so much for taking the time out of your day to meet with us. So Dr. Raymondi, before we get into our discussion today, I was hoping that maybe you can introduce yourself, kind of like your background and your specialty to our viewers.
Absolutely. So I recently opened my practice, Sir Eye Care, at the end of April, a couple of months ago, closing in on 6 months. And that's part of my week. But the other part of my week, I'm at New York City Health and Hospitals Metropolitan. So I'm a hospital-based optometrist with a concentration in ocular disease. So I see a lot of pathology, and we're able to prevent a lot of pathology too. And I love seeing kids. So that's a little bit about me. I'm a SUNY optometry class of 2015 graduate and born and raised in Queens. I absolutely love it.
Oh, perfect. Well, again, thank you so much for joining us. Thank you for that introduction. And for our discussion today, Dr. Raymondi, we were hoping that maybe you can talk to us a little bit about diabetes, specifically when it relates to our vision and to our eyes. But for our viewers who may not know, do you mind explaining a little bit about what diabetes is?
Well, sure. Diabetes actually represents a spectrum of different diseases. There's a few different types. Type 1, type 2, even a type 3 now, one associated with pregnancy. But what they all have in common is that your body has a really difficult time in processing glucose and processing sugar. And for whatever reason that might have happened, there is way too much sugar in your body, and that can be toxic. And that's essentially what diabetes is. It could be something you were born with. It could be something that happened during pregnancy, after certain medications, or also a lifestyle thing that happens.
Well, excellent. Thank you for that, Dr. Raymondi. And how can you tell if diabetes is affecting your eyes? Like, what signs and symptoms should people be on the lookout for?
Well, the interesting thing about diabetes is that when it does affect the eye, there aren't that many signs and symptoms. That's the unfortunate thing. And patients only notice when things are really, really advanced. So that makes it a very tough disease to deal with. But there are still a couple of things, if you're super aware of your eyes and vision, that you can, look out for. Sometimes there's on days where, most patients with diabetes will measure their blood sugar pretty regularly. And when your blood sugar is really elevated, you might notice that your vision gets super blurry. And then the next day it gets super clear, and that it changes like that. And that's not normal. And that's something that, you can't just wish, all right, like, I hope it goes away. It's something that you need to get checked out.
Well, definitely go get your eyes checked out. That's very, very serious. Dr. Raymondi, what can happen to your eyes if you have diabetes? Like, what are the potential effects on your eyes? Like, how the conditions, how can they develop?
Well, if you remember, diabetes is a disease where your body cannot regulate that sugar, and that sugar is stuck in your bloodstream, and it isn't able to get into the cells that need it for energy. It's not able to properly get into, your brain cells, your muscle cells, your retinal cells. So it ends up pushing and forcing its way out of the bloodstream. So one way that impacts the back of our eyes is through diabetic retinopathy. And what that basically is that the back of your eye, the blood vessels start leaking and start bleeding onto the surface of your eye, and that can impact vision. Another way, again, this excess glucose, where is it going? It can deposit into your crystalline lens, which is sitting in the middle of your eyeball. I like to describe it to my patients as like a little clear M&M that you have just hanging out in the middle there. And it's supposed to be clear for most of your life, but with diabetes and with excess blood sugar in your body, the sugar will enter the crystalline lens, and the crystalline lens becomes cloudy, and you have a certain type of cataract that could develop. And there's many types of different cataracts, but this one, it's not age related and it's more diabetes related, and it could lead to a pretty drastic change from 1 month to the next. Another thing that can be affected by diabetes is dry eye. Again, right? With this excess glucose, it can enter your lacrimal glands, your meibomian glands, and really mess with the homeostasis of that. And then you can have really severe dry eyes. And, this is all eyes, but if it's happening in your eyes, it's also happening elsewhere in your body too. The awesome thing about eyes is that that's the only place in our bodies that us eye doctors can look in without having to cut you open. We can just see things in vivo and see how things are going on. So if it's happening there, it's probably happening with your feet and like in other organs as well.
Well, perfect. Thank you for that, Dr. Raymondi, and I like the M&M analogy. Thank you for that. It made sense to me. Dr. Raymondi, I was hoping that maybe you could talk a little bit about diabetes-related retinopathy. What exactly is that?
Diabetic retinopathy is kind of like the word says, but if we break it down further, it is leaking of your retinal blood vessels. There is a wonderful thing within our entire bodies. Everything is balanced. Compartments are separated very beautifully. Things are not supposed to enter into your cerebrospinal fluid. Some things shouldn't be entering your blood and vice versa. But with diabetes, with a disease, this gets kind of thrown out. So there's too much sugar in the bloodstream. And in the back of our eye, our retina is actually an extension of our brain. And our retina has circulation, which consists of arteries and veins. And when you have elevated blood sugar for a significant amount of time, what ends up happening is that the blood cells, the walls of these blood vessels start to weaken, and they begin very slowly by just outpouching. And that is already away from normal, already pathological. And when it starts ballooning out like that, it's little outpouchings. And during an eye exam, when I dilate a patient's eye and I look in, I'll see these teeny tiny balloons that if I had looked quickly, I would miss them. They literally look like one little pixel of red where it should not be. And they are called microaneurysms. So it starts off like that. And when a patient has microaneurysms, this is called mild non-proliferative diabetic retinopathy. And when you have that, you really don't feel that bad. Your blood sugar levels may only be slightly elevated. And the only way a patient's going to know is if I show them in a photo. So there's steps to it if you're kind of like following along. So there's mild, right? Mild would start with this outpouching, these tiny little spots of blood. Now, let's say, because of the pandemic happening, early on, patients were afraid to leave their house, might have had a hard time getting refills, or they really weren't sure how to navigate, the different new curbside or phone call systems. And unfortunately, a lot of people were without medicine for a while. What happens then? Your blood sugar's elevated for an even longer time. Maybe you already had microaneurysms that you didn't know about, those teeny tiny little spots. And those teeny tiny spots end up becoming bigger. And there's more leakage. And the blood vessels start to fenestrate. We call it fenestration. And it's leaking. It's forming little windows. And that leads into us having dot blot hemes. And they look just like a pen blot, dot blot hemes. And they can start off in one area of the eye, and then it'll end up covering more of the eye. But the thing is, a lot of times it avoids your central vision. So again, you're not going to feel when you have moderate non-proliferative diabetic retinopathy. You might have a lot of spots of dot blot hemes, a lot of microaneurysms. You're going to feel fine. The next step is severe non-proliferative diabetic retinopathy. So that's when it's basically all over your entire eye. You might have other signs of inflammation too. And that, again, maybe you'll notice like a tiny difference, but still, you'll still keep on going. Patients notice a difference when your macula starts to get swollen, because your macula is the center of your vision. It's what you use to read. It's what you use to like identify people's faces. And when you have clinically significant macular edema, that's the other level of diabetic retinopathy. And then, unfortunately, the one time that patients really do come in is when they have proliferative diabetic retinopathy. Everything else was non-proliferative before. It's just like, leaking and stuff. Proliferative means that everything has gone so awry that new blood vessels start growing where they shouldn't. And what's the big deal about new blood vessels? Isn't that a good thing? Well, no, because we already had blood vessels with good barriers. Those were broken. We're not growing new good blood vessels. We're growing new shunted vessels, new, completely mutated blood vessels, and they start leaking all over. And they end up causing tissues to grow in your eye, and they'll tear from diabetes, and it could completely cover your eye. And that's where things get pretty serious, and it's a vision threatening for sure. So it's a long process, and it would be amazing to be able to let patients know about it very early on, when there's just that one dot of blood.
Well, fascinating information. Thank you so much for that, Dr. Raymondi. And so we talked about the different stages of diabetic retinopathy, but what are the treatment options that are available?
The best treatment option is early detection and patient education. Because remember, we just went through this whole cascade of events. It all starts on everybody with just that one little teeny tiny drop of blood that should not be there. So what would I do with my patients? I will review their A1C levels with them. And more often than not, right? Even when I'll go to another specialist's office, sometimes I'll be afraid to ask, hey, what does that really mean? I don't really know. And with diabetes, if you don't know where you're at with your blood sugar levels, how can you ever improve, right? If you just keep on hearing high, that's just, it just means like, yeah, I'm high, I'm not doing good. But if your eye doctor tells you, hey, you're at a 9.5 right now, let's set a realistic goal and bring it down to an 8, and then a patient's able to bring back control, and tying that information from the picture that I take of their eye versus showing them the blood sugar levels, that helps us prevent any further treatment. Because when it's just one tiny dot of blood, our body is able to reabsorb that. And sure enough, if I have a patient come back in 3 months after educating them, that drop of blood will disappear. And even at moderate non-proliferative diabetic retinopathy, when there's more of the dot blot hemes, your body still wants to heal. It wants to reabsorb it, and it will. And that's an incredible thing. But of course, it sometimes gets to a level where you can't go back from, and we kind of lose control. So what we can do is there are focal laser therapies, which I would refer to an ophthalmologist to do. There's intravitreal injections, right? There's a whole host of things that could be done. But the best is early patient education, because if you know that if it gets out of control, you're going to get a shot in your eye, you're going to do the difficult things that you already know to do, right? Like everybody knows you have to eat better. Everybody knows that you got to lose weight. And that it's one thing to say it and one thing to do it. But then when you know what the consequences are of not doing it, it just kind of like gives you a goal in terms of what to aim for and to prevent vision loss.
Well, absolutely. Early detection, like you said, very important. Again, amazing information, Dr. Raymondi. Thank you for that. And Dr. Raymondi, what are the potential long-term side effects of diabetes-related eye conditions?
Well, there's many, unfortunately. I mean, one thing that, as you asked me that question, I just think about the point that I mentioned earlier, how it's happening in your eye, it's happening all over your body, it's happening in all the tiny blood vessels at the end of your fingers, at the end of your toes, in your internal organs. Things can get really bad. And unfortunately, I think we all know someone where diabetes has been life-threatening and life-ending, and it oftentimes snuck up on people, right? So that's the unfortunate thing. But in terms of eyes, when I started practicing 6 years ago, there was so much more vision loss related to diabetic retinopathy that I would see daily. Um, you would see all this bleeding that would start to coagulate in the back of the eye and create large fibers, like large sheets of fabric of blood, you could almost say. And that it becomes sticky and it pulls on your eye, and you have vision loss. And yeah, if it's not treated right, that's something that can happen. You can unfortunately go blind, and so many people do. And that's why it's really important to have that early detection. Another thing, the cataracts are always fascinating to me. I love everything about eyes, so to me it's all fascinating. But cataracts are usually an age related thing that happens to everyone if you live long enough. It's like a tree trunk thing. But with elevated blood sugar and diabetes, you can see one patient 1 week and their vision's 20/20, but they have an elevated blood sugar levels. And then you'll see them back. They'll come back in 2 months like, oh my gosh, doc, everything's really blurry. And you look in and the cataract has formed. So that's something else that happens. Patients have to undergo cataract surgery when they're really young. And there's just a whole host of things that could happen. And again, it's a lot of patient education that needs to take place. But once you do it, you see a huge difference. And now 6 years after that I've been doing this and checking people's eyes all the time, I I haven't seen like a really, really bad case right now where it was just complete neglect. I think it was one maybe like a couple months ago where it was severe diabetic retinopathy. But yeah, and once people learn about it, you can make a big difference.
Well, definitely. And we love that you love eyes just as much as we do, Dr. Raymondi, and thank you for that information. Dr. Raymondi, like, what advice would you give to your patients with diabetes as far as like a regular eye care routine is concerned? Like, what advice would you give them?
Well, for them, if they've been diagnosed with diabetes and they haven't had an eye exam yet, which I know you're watching, I know a lot of you follow me on social media and still haven't had an eye exam, you need to go get one. And anyone who has eyes, if you got two eyes, you need an annual eye exam. Why? Because that's a great time frame to really catch any changes and to see how things are going. You know, I think with most diseases too, if this is your first time coming in, of course we're going to do the absolute most that we could to treat you and everything. But it would be awesome if I had records of your eyes from prior years. So it's super important to get your eyes checked, especially if you don't wear glasses and if you have sharp 20/20 vision, because our eyes try to balance themselves. It's just the way of nature, right? It's just the miracle of life. That's the last thing that'll be impacted. So it's up to us to use our scientific tools and all the new knowledge, technology that we have, and be proactive and come on in for our eye exams. And then I'll have a look and I'll be like, all right, yeah, you're still a sharp 20/20, but we have other things going on too. So, and another point that I made earlier, don't hope that things will go away. Don't hope that it'll fix itself. If we learn anything this past year is that we have to put our health first and really think about keeping our bodies well and healthy and okay, and keeping track of everything.
Well, you're absolutely correct about that. Everyone needs to take care of themselves. Absolutely. Thank you, Dr. Raymondi. And are there any preventative measures that someone with diabetes can take in order to maybe say prevent any like disease development from happening?
Well, one, the annual eye exams for sure. Another is to, ask many questions of your different providers, because at that point you'll have a lot of providers. You'll be having a lot of lab results. If you don't measure it, you can't improve on it. That applies to so many things in life. And that also applies to your blood sugar levels, to your cholesterol levels, all these different things. And also we all know again that lifestyle changes are the best thing that we can do. And with lifestyle changes, right, we know these things, and setting realistic goals, like a realistic goal that I like to tell patients is like, well, hang on, like, let's really think about it. Like, you don't have to, yes, it would be amazing if you could eat a Whole30 diet, or if you could eat like kale and all these things and gluten free, but that's not realistic. I'm like, let's really break down what you eat. Okay. And then, sometimes I'll find out that they do drink soda like twice a day, right? Like a little bit of Pepsi. And I'll say, that's a really easy thing to completely eliminate. Eliminate that. You could still have your bread, and then once they do that, you give them the other goal, like okay, you're still eating maybe a slice of cake with each meal or something like that. It happens, right? Then it's like, okay, cut your portions, cut it down, and then doing all those sorts of things and not beating yourself up about it too. I think another preventative measure is knowing your family history of different diseases, because diabetes becomes so much more difficult to manage when it's like also like part of your like DNA too. So that sort of thing, and always informing yourselves. I love it when patients get educated about their own diagnoses, because they get it spot on once you like show them the way. And then they're like, all right, let me go on through that YouTube search, go down that Google rabbit hole, and they understand like even the most complex procedures completely. So yeah, those kind of things that patients could do.
Well, absolutely. And I know we've said it before on this channel, guys, but make sure you go to get that annual eye exam. Thank you again, Dr. Raymondi. We appreciate that. And are there any new technologies or new developments out there that are in this that we should be on the lookout for?
Well, there are a lot of new retinal cameras, and these retinal cameras can take really nice detailed pictures of the back of your eye. They can measure the thickness of that macular or center vision swelling to the micron. So that's something that we can use. There's also that we use it on the daily in clinics, but they are becoming much more sophisticated. And again, it's also for record keeping, right? We could see like, hey, in 2010, everything was absolutely perfect. And then, and so forth and so on, things progress. But another awesome thing that's happening is that a lot of large hospital systems are implementing a diabetic retinopathy screening. So what is that? Like they'll have many systems, including New York City Health and Hospitals has one where on the busiest floor, the primary care doctor general floor, they'll have a camera there, and they'll send all their diabetic patients there to take a quick picture. And then they will send it to the team of ophthalmologists and optometrists to look over and see who needs to come in a little sooner than later. And the awesome thing about that is that patients remember like, oh, someone took a picture of my eye. What happened with that? Versus just being told, like, hey, you need to go to the eye exam. And then they may not, we might lose them through the cracks. They might not schedule their appointment because you'll forget it. But you don't forget when someone takes a picture of your eye. So that's something that's pretty exciting that's coming down the pipeline. I think too, genetic testing is becoming much more available to everybody. So that's something else to look out for, to see how, if maybe you don't know your family or anything like that, if they have diabetes.
Well, definitely very exciting developments. I definitely would not forget someone taking a picture of my eye either. Yeah. But definitely exciting. Thank you for that, Dr. Raymondi. And before we leave today, was there anything else that you'd like to tell our audience?
We covered so much. I would say be curious about your health. Keep looking into different things. Ask friends or family members who also have diabetes or any other eye condition how it was like, what's going on, even though diabetes is it's an unfortunate condition, right? It's very interesting to hear from people who have had the laser procedures that I spoke about, who have had these eye injections, and many of them are able to get it just a couple of times, and the intense diabetic retinopathy doesn't come back. So just be informed and always stay curious, and keep learning about your eyes. Who knows what we're gonna learn about next year.
Well, definitely. You're definitely right about that. Again, that was Dr. Damaris Raymondi from Sur Eye Care in Queens, New York. Dr. Raymondi, thank you so much for joining us today.
All right, thank you for having me. Bye. Hola a todos, yo soy la doctora Raymondi y les voy a hablar hoy a ustedes sobre la diabetes y cómo la diabetes puede impactar al ojo. Yo soy una optometrista y todos los días yo examino los ojos de los pacientes para diferentes enfermedades. Y una de las enfermedades que sucede y impacta al ojo es la diabetes. Desafortunadamente, la diabetes es súper común en nuestra comunidad hispana. y tenemos que estar bien alertas a los cambios que pueden suceder. Si usted todavía no se ha examinado los ojos este año, debe hacerlo, porque la diabetes es lo que causa ceguera. Y a lo mejor usted conoce a alguien a quien le impactó la diabetes y perdieron la visión. Pero la mejor manera de prevenir esa pérdida de visión es con prevención y educándose uno sobre su condición. Lo que puede suceder en el fondo del ojo es que puede haber retinopatía diabética, puede empezar a sangrar al fondo del ojo. Y cuando empieza a sangrar, nosotros no nos damos cuenta de que hay algo mal y hasta todavía puede uno tener una visión perfecta a 20/20. Y entonces esa es la razón por qué es importante chequearse el ojo, revisarse, hacer preguntas a sus doctores: qué significa mi nivel de azúcar hoy en el cuerpo, cómo lo puedo mejorar y qué puedo hacer para prevenir que esto impacte a mi ojo. No se olviden de siempre hacer preguntas y siempre ser curiosos, y espero que siempre se sientan bien. Hasta la próxima.